Today I'm going to talk about an overview of challenges in acupuncture research. Before I begin, I would like to declare that I have no competing interests in relation to this project. Today I'm going to talk about, first of all, specific versus non-specific effect of acupuncture treatment. I will start with the efficacy paradox, and we're going to have a look at the factors claimed to affect specific effect of acupuncture. And then I'm going to introduce a preliminary result of our research about needling depth, and I'll conclude my presentation with some future research directions. First, I will start with the efficacy paradox. I'm sure that everyone in this room would be familiar with efficacy paradox. Here, we've got a trial where we compare treatment X with placebo X. And in this trial, we are unfortunate. We failed to demonstrate a better effect of treatment X over placebo X, probably it's because the specific effect of treatment X is not very big. Now, how about this? We've got another trial where we compare treatment Y with a placebo Y, and this time we were lucky enough to demonstrate that treatment Y is efficacious because it's superior to a placebo control, right? Are you happy with this situation? I guess not. Because this effective treatment Y might be ineffective when it's compared with another treatment, in this case treatment X, which is not significantly better than its own placebo control. Why is this happening? Because probably the non-specific effect in treatment X is quite large, isn't it? And we all know that one good example of efficacy paradox is acupuncture treatment. In 2011, the Society for Acupuncture Research published a white paper where they outlined two paradoxes in acupuncture research. The first one is verum acupuncture is indistinguishable from sham acupuncture control. And the other is that results of basic research or animal studies are not directly applicable to clinical research or clinical practice. They seldom translate into clinical outcomes, right? So let's look at the first paradox where there's no difference between verum and sham acupuncture treatment. In this situation, the most common interpretation of this situation is that acupuncture is mere a placebo. The sham acupuncture is quite stronger than we expected it to be, or it is supposed to be. And there must be factors contributing to therapeutic effects of sham. Basically, acupuncture is a complex, multi-component intervention. And it's not easy to define which components are to be avoided in developing sham controls. We also have strong evidence from Professor Ted Kapchuk at Harvard Medical School that sham acupuncture is a powerful placebo, much better than a placebo pill. On the other hand, there should be factors potentially contributing to decreased therapeutic effects of verum. We often test poorly validated acupuncture protocols, and we also have a number of ideas on appropriate acupuncture treatment, which are not easily agreed upon. So we are likely to simplify or modify acupuncture treatment that we are doing in routine clinical practice. As a result, we may be testing suboptimal acupuncture treatment, and we may end up with a decrease in effect size. Before we simply conclude that acupuncture is a placebo, there are a lot of factors that need to be reconsidered. Since the 2011 white paper by the Society for Acupuncture Research, I'm afraid we're not progressing a lot. Based on previous studies, I have drawn a picture of the specific and non-specific factors that may contribute to the effect of acupuncture. What factors can you think of that contribute to the specific effect of acupuncture? First of all, the specific components. I divided the specific components into 3 parts. For the needling components, we consider that needle insertion or penetration, needling depth, and needle type are important. And also points matter as well. We care about the number of points needled, and we often think a lot about which acupuncture points to choose and how to combine them. Needle stimulation method or the stimulation strength is also a controversial issue. Which is more effective, manual acupuncture or electroacupuncture? And if electroacupuncture is better than manual acupuncture, and for which conditions? There are a range of manipulation methods, so choosing the optimal method is not an easy job. Which responses are we inducing? Duchi, sensation, twitchy response, or is it Japanese acupuncture, Toyo Hari? Is it enough? Superficial needling, I mean. A lot of clinicians think that needle retention time is also important to get a maximal treatment effect. Then how about non-specific components? Expectation of acupuncture, preference or cultural difference, experience with acupuncture, healthcare setting, attention, credibility. These factors are common to all medical interventions, not only to acupuncture, but also they are applicable to all medical interventions. However, there are factors that may affect both specific and non-specific effects. Things like doctor-patient relationship, practitioner characteristics, and treatment schedule, frequency of treatment or number of sessions. These may be affecting both specific and non-specific effects. This is why testing acupuncture properly is more difficult than other medical interventions. As we do not have solid evidence on these factors, or we're not sure about specific components of acupuncture, the paradox where varum acupuncture is not different from sham acupuncture emerges. So, we're left with the question, which components of acupuncture needling are therapeutically important? Or how can we determine optimal dose of acupuncture? We divide the factors involved in the optimal dose of acupuncture into needling components and treatment schedule. And we planned a series of systematic reviews and meta-analysis investigating these components in order to inform future acupuncture research. So I brought a sample slide. We searched PubMed and CNKAI databases up to July this year using various search terms. This is an example of needling depth. We selected human studies meeting the inclusion criteria. In this case, studies comparing different depths of needling, superficial versus deep. Then we extracted data, conducted risk of bias assessment using the Cochrane risk of bias assessment tool, and pulled studies where relevant data are available. We included 54 studies out of 2,204 articles from the search. And there were 11 studies investigating the needling depth. We tabulated the extracted data like this table. They involved patients with various conditions, and almost all studies reported that deep needling is more effective than shallow needling for a variety of conditions. I did not put the slide for the risk of bias assessment or meta-analysis in my presentation, and I hope I can share the results as soon as it's published. The results is only preliminary, but other series studies are ongoing. And based on our analysis, I would like to suggest some future research directions. A two-track approach can be efficient, I think. The first one is clinical practice-informed approach, and the other is basic science-informed approach. For clinical practice-informed research, we need to directly compare different acupuncture treatment protocols in adequately powered clinical trials, combining large data sets from high-quality trials to examine the different components of acupuncture protocol would be also beneficial. And we need to be very clear about our reporting, what research hypothesis we're testing, and what is shunned in our controlled studies. And for basic science-informed approach, we need to study physiological effects associated with needling and non-needling components of acupuncture. In addition, it would be better if we can determine how to measure immediate or delayed physiological responses to needling. This may be done by finding appropriate biomarkers or developing adequate clinical outcome measures. So this would be my last slide. We've got a long way to go. But if we can work together, I think I can go up there and probably understand what components contribute to the specific and non-specific effects of acupuncture treatment. Thank you for your attention.